Richard Branson make money out of our health service.
Keep the NHS public. Keep the National Health Service public. Don't let him make millions that should be spent on care.
I'm campaigning along with many others against the wholesale privatisation of the NHS, and in particular Virgin Richard Branson's bids within the NHS to take it over for very little money to make profits out of our ill health.
Well, I've grown up with the NHS like millions of other British people, and it's been a great service for me. It's saved me on a number of occasions. I think the principle of the NHS is absolutely right, that welfare is something that shouldn't be in the marketplace, and I don't think that privatising the NHS and letting Branson and Virgin make millions out of it will help it whatsoever. That money is going to be taken out of services that are needed by people when they're most vulnerable. The whole principle of the NHS is that it should be free to anybody who needs it. You can't do that in the private sector.
Do you want to go back to the system like we have in America, where if you're poor and you can't afford to pay health insurance, you literally die on the street? That's what Richard Branson is doing. I think he's doing to our health service.
Well, my mum is 92. She remembers the days when she was a girl, when you had to pay for healthcare, and if you didn't have enough money to pay 2 and 6 for the doctor, you didn't get healthcare. And then after the war, the NHS came in. It was a tremendous achievement that people got a health service that was free for everybody. You didn't have to pay, that everyone, rich or poor, got the same treatment. And I just think that actually it's going back to what it was before the 1930s, that people are going to have to pay for their health care. The Tories are selling off absolutely everything, education, health, anything they can sell they will to private companies, and they say private is better, and that's absolutely not true. Because if you look at Serco, which is a private company, it's failing to run services that it's taken over already. For free schools are failing, academies are failing. Private is not better. Public service is there for people when they need it. We pay our taxes. There's no reason why we can't have and continue to have the best health service in the world. God forbid that we should ever live in a place like America, where poor people die on the streets because they haven't got health insurance. I don't want to see Britain go down that route.
We do not want homeless people dying in the street because they cannot afford medication and vital operations to survive.
I'm 65 years old, and when I was born, the NHS was also just born, and it was immediately after the Second World War, so they'd spent millions and millions of pounds fighting a war, and it must have cost a huge amount of money and effort to set up the NHS with public money. It's our public service, and it should not be flogged off now so that others can make a profit out of it.
Virgin are gathering like vultures to make profits out of people's misery.
Send a clear message to Richard Branson and the fat cats, the greedy fat cats who want to make money out of our health care. Our health service is not for sale.
Private companies running health services in the interests of their shareholders, their investors, and therefore against the interests of patients and taxpayers. All the evidence worldwide is that when healthcare is privatised, costs are increased dramatically and quality of healthcare provision falls.
If the National Health Service is privatised, those people who have the money to pay the bills will have less time to wait, because they'll cut the people who can't afford to pay out of the queues. We say, of course, the National Health Service can be improved. The way to improve it is to develop it further with more government funding.
Money, money, money. Money for Branson. Money for operations. Money for limbs. Money for organs.
What kind of reception have you had from the public?
A really positive reception. Lots of people have left their email addresses because they want to be involved, or they've left comments saying why they support. Worryingly, lots of people weren't aware of the changes that were happening, and I think that's a damning indictment of the BBC and other press that have given very little coverage to the campaigns that I know have been going on for the last couple of years, because I've been involved in them. So when people heard about it, realised what the implications are, a lot of people were very angry, very proud of the NHS, and that are very worried about the emergence of a two-tier health system.
When people start to realise that their local health services are being privatised and taken over, I think that's when you're going to get a very big fight back.
The vast majority of the public have been very, very supportive. They know the NHS is a valuable public institution and it shouldn't be given away to private profiteers.